Have you ever thought about aging not just in terms of your skin or hair, but your penis? Yes, that's right. Just like other parts of the body, the penis also undergoes an aging process. The good news is there are clinically supported, evidence-based strategies that can significantly slow down this process and help you maintain both your sexual vitality and penile health for many years to come. My name is Dr. Fiona, and I'm a board-certified urologist. In this video, I'm going to share 3 crucial steps every man should implement to prevent premature penile aging and maintain optimal erectile function throughout life. If you're aiming for a healthier aging process, including your sexual health, then stay with me till the end. So let's begin by understanding what we mean when we talk about penile aging. As the years go by, biological aging gradually affects penile tissue, much like it affects the rest of your body. Just as skin loses elasticity and hair turns gray, the internal structures of the penis are also impacted. One major change occurs in the corpora cavernosa, the 2 cylindrical structures that run along the shaft of the penis, responsible for its rigidity during erection. With time, the elastic and smooth muscle fibers inside the corpora cavernosa diminish, often replaced with collagen, a less flexible, non-contractile tissue. This shift results in a more rigid and less compliant penile structure, which directly influences erectile quality in aging men. Furthermore, vascular health in the penis declines gradually, meaning arterial blood flow becomes less efficient. A significant decrease in nitric oxide production, a critical vasodilator responsible for initiating and sustaining erections, is commonly seen with age. This, combined with a natural decline in testosterone, leads to reduced pelvic circulation, decreased penile oxygenation, and, in more advanced cases, penile atrophy, a decrease in size or structural degradation of the organ. For many men, this can manifest as a weaker erection, reduced sensitivity, and in some cases, even a visible change in the shape or appearance of the penis. But here's the essential part. You can proactively slow this down. Let's take a look at 3 fundamental strategies that science has shown to be effective in maintaining penile youth and function. Strategy 1, prioritize your cardiovascular health. If there's one foundational rule for protecting your penis as you age, it's this. What's good for your heart is good for your erection. The penis is a vascular organ, and an erection is a complex vascular event that relies on uninterrupted blood flow and healthy blood vessels. That means underlying conditions like hypertension, high cholesterol, atherosclerosis, and diabetes, all of which impair blood flow, can and often do negatively impact erectile function. It's essential to manage these risk factors early. Smoking, excess alcohol, and a sedentary life not only age your cardiovascular system, but also impair penile function. Recent studies have shown that even moderate alcohol consumption may accelerate age-related damage, not just neurologically and cognitively, but sexually. Contrary to popular belief, no level of alcohol has been proven completely safe, and limiting or eliminating alcohol intake can strongly benefit penile health. On the proactive side, regular physical activity, particularly cardiovascular exercise, has been shown to enhance endothelial function, improve blood circulation, and increase testosterone sensitivity and production. This kind of movement also aids in maintaining healthy body weight and boosting insulin sensitivity, all of which are key to reducing the risk of erectile dysfunction and preserving vascular integrity. Nutritionally, your focus should be on anti-inflammatory, antioxidant-rich foods that promote circulation. A fantastic evidence-based option is the Mediterranean diet, lauded worldwide for its protective role against cardiovascular disease. This diet encourages whole grains, legumes, nuts, olive oil, lean proteins like fish and white meat, and plenty of colorful vegetables and fruits. Foods like beets, spinach, dark chocolate, and berries all naturally support nitric oxide production and vascular health. In short, move daily, eat smart, and avoid substances that harm your body's vascular system. Your penis and your future self will thank you. Strategy 2, keep the penis functionally active. Just like any other muscle or organ, use it or lose it applies here. The penis thrives on activity, and regular erections are vital in keeping the tunica albuginea and corpora cavernosa oxygenated and elastic. Naturally occurring nighttime and morning erections, known as nocturnal penile tumescence, act as automatic maintenance checks for the erectile tissue. These spontaneous erections provide rich oxygenated blood flow to the penis, which is critical for preventing fibrosis and tissue atrophy. If these erections become less frequent, whether due to age, illness, medications, or inactivity, your penile tissue may begin to stiffen and shrink, a process often observed in long-term cases of untreated erectile dysfunction. For men who are experiencing erectile dysfunction or aren't having regular erections, even involuntarily, there are several therapeutic tools that can help. Options include 1. Pelvic floor physical therapy, which strengthens the muscles involved in erection and ejaculation. 2. Vacuum erection devices, penile pumps, that mechanically draw blood into the penis, useful for maintaining vascularity and preventing shrinkage. 3. Targeted medications, prescribed under medical supervision, to stimulate or support erectile function. Every form of stimulation that increases oxygen-rich blood flow to the penis helps preserve tissue elasticity and erectile responsiveness. Think of it as regular exercise for a crucial organ. Strategy 3. Optimize and monitor your hormonal health. Let's talk testosterone, the primary male sex hormone, and one of the biggest players in maintaining erectile and overall sexual health. Testosterone isn't just about libido. It plays a critical role in preserving penile muscle fibers, preventing fibrosis, and supporting the vascular and neural mechanisms responsible for erections. Around the age of 40, testosterone levels begin to fall by approximately 1 to 2% per year, a phenomenon referred to as andropause, or late-onset hypogonadism. While some degree of decline is expected, this can be amplified by chronic illnesses, obesity, lack of physical activity, and poor nutrition. Low testosterone not only affects mood and energy, it accelerates the process of penile aging by pushing your body to replace muscle tissue with fibrous tissue. That's why monitoring your hormone levels, especially in midlife, is important. In men whose testosterone levels fall significantly below the normal range and who also experience sexual dysfunction or other symptoms, testosterone replacement therapy, TRT, may be considered. Of course, any hormone therapy must follow comprehensive clinical and laboratory evaluation and be discussed thoroughly with a qualified healthcare provider. Emerging research also shows that declining testosterone levels are associated with decreased nitric oxide synthase activity, which leads to a drop in the body's ability to produce the nitric oxide necessary for healthy erections. Ensuring hormonal balance helps preserve this function and reduce the progression of aging changes in the penis. Final thoughts. Well, aging is inevitable, but how you age is a choice. You can't stop time, but you can decide how gracefully you move through it. By maintaining your general health, staying sexually and physically active, and supporting your hormonal and vascular systems, you can slow down the natural aging process of your penis and protect your sexual health into older age. And if you're already noticing changes or have concerns, don't ignore them. Early intervention matters. Consult a trusted urologist or hormone specialist. Prevention and proactive care are far more effective than late-stage treatment. If you found this information helpful, be sure to share it with others and consider subscribing for more insights into men's health and sexual wellness. Stay well, and remember, your health is your greatest asset.